right, good morning from cloudy Berkeley, California. Today I have with me Kristine Cannon, who is a senior manager for continuous process improvement at UCSF Health. Kristine, we're here today to talk a bit about process improvement within the healthcare arena. So I want to just jump into it, kind of talk a little bit about your background and your story, kind of how you found yourself in this space.
Yeah, absolutely. Thanks so much for having me. So my background is a little probably non-traditional for most people in healthcare. I actually started my career journey working with kids, teaching them singing and dancing, and realized as I was traveling the world with the opportunity to do that there were so many different economic and health-related issues in the places that I was traveling to, and just became much more interested in going to school to learn more about those things. I studied economics at USC, and then worked at Google for a little while just to get some solid business experience. Ended up at Berkeley to get my master's in public health. And then I spent 5.5 years at Kaiser Permanente working on their performance excellence team, which led system-wide process improvements for the Northern California region of Kaiser. And I've been at UCSF now for 7 months, leading improvements primarily in the pediatric critical care space.
Okay. So tell me a little bit about how you approach process improvement, sort of how you understand sort of the key problems and how you work around to identify solutions.
Yeah, so I have a diverse set of training that I've been through to learn how to be a good problem solver. There is an actual systematic approach to doing good problem solving to make sure you're addressing the root issue. My training is through primarily through Kaiser, but we trained on the Institute for Healthcare Improvement methodology as well as Lean and Six Sigma. So I've got quite a breadth of training across using those different skill sets on how to go about solving problems. And it really starts with actually stating what problem it is you're trying to solve, which is, I think, a lot of times people don't stop and actually pause to think about that. Setting a goal for where you think you should be with that issue, and then doing a root cause analysis to really understand why you're not actually performing where you think you should be. And then from there, understanding those barriers and then identifying countermeasures that you can take to overcome those barriers and achieve what you've set out to do. And then, of course, after you do tests of change to learn about what it is actually works to solve the problems, you then create an extensive sustainability plan that includes monitoring over time to make sure that your results don't drop. So there really is sort of a step-by-step systematic approach to make sure you're covering your bases and truly solving the root of the problem at hand.
Okay. And so from the healthcare perspective, what are the key problems that you see from a process standpoint within care delivery that really needs a complete retooling or rethinking of the processes that go on to support clinicians?
Yeah, I mean, healthcare is a playground for people that are interested in doing problem solving. I think as patients and consumers who interact with healthcare, from that perspective, there's a whole host of issues, including things like waiting, feeling like people are giving you the runaround, maybe having to give your patient history information multiple times, leading to redundancies. From a clinician perspective, there's things like searching for equipment, for supplies, things like transport. Why do I have to take somebody so far away to get something done? Can that procedure not just come to me? There's still a lot of waiting from a clinician standpoint, waiting for test results, waiting for pieces of information that you need to be able to figure out where to go next with the patient's care. Over processing, we do sometimes do things so many times because we don't know someone else has already done it. There's so much opportunity in healthcare in terms of retooling and redesigning processes pretty much from end to end. There's so much, I feel like, legacy processes and just things that people have been doing forever that, they've never really stopped to challenge the status quo because they're so time constrained. And, it really truly is a playground for people like me.
So what are the sources of resistance that you've found? You mentioned, that there are a lot of legacy processes that maybe don't make sense, but haven't been revisited because people are time constrained. So can you talk a little bit about some of the difficulties that you encounter in your work in actually starting to implement some of these re-engineering processes.
Yeah, I mean, there's people who, one, have been in the industry forever and are experts in what they do, no doubt, and no one denies that. But there may be new technology or, things in that process that could be removed, but they've been doing it for so long, so they're just naturally resistant to change because that's how they've always done it, and that's just the way it is. That's probably the most typical response that I get in healthcare in terms of resistance. I mean, like any of us who have tried to change something in our own lives, like going on a diet or exercising more, it requires a lot of behavior change, and behavior change is really hard, particularly in academic medicine, where in some cases, some of the physicians that I'm working with, they're only maybe here 8 to 10 weeks out of the year. So it's like, what is their true incentive to really learn a new way to do something when they're just not here that often, because maybe they're primarily a researcher or something like that. So yeah, that behavior change component is always huge. And ultimately in the long run, in order for things to sustain, you really do have to have an element of culture change. And that stuff just takes time. So like the patience that maybe the trailblazers need to have, it can sort of wear thin on people that have continuously been championing things. But you really need those people to step up and keep pushing along in order to really change the culture to get where you need to be.
Yeah. So that sounds like a pretty daunting task. So can you point to some real world examples of projects that you've been on where you've been able to successfully implement some of these process changes?
Yeah, I have a large and a small example. So I'll start with a small example. One of the units that I've been working with at UCSF faced some real challenges in getting people to appropriately wear personal protective equipment when going in and out of patient rooms. This may sound like something that is, maybe a little nitpicky to someone on the outside, but for those that work in healthcare, wearing the right personal protective equipment means you're not spreading infections to yourself. You're not spreading infections from one patient room to another patient room. So it really is important because hospital-acquired infections are still a huge issue, and we need to make sure that people are protecting themselves and the other patients and clinicians that they're working with. We had a 0% compliance rate when we started doing some observations. It's an all or nothing thing. So you miss one piece of thing that you need to be wearing and you lose all the credit.
Yeah.
So we identified a nurse champion that could work with us and do more observations and just-in-time education for people. And then we started playing around with things like what supplies we stock in the caddies that are on patient doors. So, we moved things around in the configuration. We changed out some of the signage. We actually tested different products because people were complaining about, these mask things fogging up all the time. Ultimately, the nurse champion and then removing these yellow masks, so people were always required to wear a mask with a face shield, ended up having us go from 0 to 95%. And, that was over a course of like 6 to 8 months. So it took a lot of extensive education and a lot of these different tests of change to really see what worked. But those were the two things that really stuck. And, for the last 3 months, we've been at 95% compliance and above for the unit. And that's, with 60 plus observations that are happening. It's not like we only look at, 10 or 20 people. It's a fairly extensive set of observations to pull from. So that's a smaller example. A larger example is actually a project I worked on with Kaiser around preventing hospital-acquired pneumonia. This was a 2-year project because there wasn't a lot of literature out there about what actually causes hospital-acquired pneumonia and who's more at risk. So it started with a fairly extensive in-depth research by a clinical team to really do a lot of chart reviews and try to understand who ended up getting that infection more than others. And then once we had that risk criteria identified, we started doing small tests of change on what interventions we thought could actually lead to a reduction. It ended up being things like brushing someone's teeth regularly, keeping the head of bed elevated so people wouldn't lay back and then aspirate into their lungs, which would then lead to pneumonia if they were sick enough. Things like getting people up and walking, things that seem like going back to the basics of how you just care for someone when they're an inpatient, but it sort of reminded everybody that those things are so critical, not just for, normal patient care, but they actually do prevent a lot of these really serious conditions that can lead to death ultimately. Mm-hmm. And again, we did that through the small test of change process, both on the bundle itself and the interventions, but then also some rapid cycle testing with our electronic medical record team to figure out the right way for people to be documenting when these things took place and alerting the nurses to know when they're overdue for actually doing one of those interventions. Okay. And so that one was really cool. We ended up spreading that one to all 21 hospitals across the Northern California region. Mm-hmm. But to have that technology component and the patient care component was a really nice collaboration.
Okay. So what are some ways that we can keep some of this positive momentum going?
Yeah, I think you really do need to have champions at every level of the organization. It can't be only bottom down or bottom up and top down. It really has to be a combination of both. And you need people that aren't going to get burned out by being those champions. Mm-hmm. For someone like me, it's my job. And I'm naturally passionate about it. So it's really easy for me to keep that momentum going. But for the people that are out in the field, it's so easy for them to just get overwhelmed by this kind of stuff. Mm-hmm. Finding good champions, continuing to grow champions over time, having those success stories, so finding small wins when people are first doing this work mm-hmm. is so important because you really have to have those stories to tell. And so whether it's staff stories or even getting some patients to tell a story about how some of the improvement work has impacted them, really go a long way to getting people on board. And then just making the work visible, having leadership involved to congratulate and celebrate the great work that people are doing to reinforce the positives. But also to talk about it out in the community, talk about it with other units, get people to go and see what other people have been doing mm-hmm. as a result of, really dedicated improvement work. And if you can do, a combination of those things over time, you'll really start to see the culture and behavior change where people get excited and motivated to want to try new things.
Mm-hmm. Well, we look forward to your continued success. And
thanks.
Yeah, thanks so much for stopping by and sharing some nuggets of wisdom with us. Everybody, this has been Kristine Cannon, and we look forward to seeing more from her.
Thanks.